Hello and welcome to our virtual workshop with Dr. Bill Hoy. I'm Becky Lamaka, the Director of Grief Support and Education at O'Connor Mortuary, and we're very pleased to have Dr. Hoy with us virtually this week. And today's session is practical tips for helping others during COVID-19. Regardless of who you are and where you are, you have most definitely been affected by what is going on in our world. And Dr. Hoy is going to spend the next several minutes talking with us about very practical tips and things that we can do to help others with some of the anxiety and isolation that they're experiencing. Dr. Hoy is a professor at Baylor University when he is not with us on a quarterly basis, and teaching our up-and-coming medical students on the subject of death, dying, and bereavement. Dr. Hoy, we are sorry we're not able to have you in person with us this month, yet we're very pleased that we were able to create this virtual webinar, and I'm going to hand it over to you.
Well, thank you, Becky, and I am excited to be speaking to you from hot Central Texas, where it is a beautiful day, but I wish that I were in Orange County today. I know that this has been a very difficult, unique, and challenging time for all of us. And so I'm excited to get to spend a bit of time with all of you. Whatever time of day or evening you happen to be accessing this recording. So one hardly needs to pick up the daily newspaper, tune in to a news broadcast, or start your internet search engine without being reminded that we are living in very challenging times. And my task today is actually to spend some time leading us in a conversation, albeit a one-way conversation in a lot of ways, on practical ways to respond to the COVID-19 pandemic as we seek to help others deal with the challenges that are part of this experience. And so what I'd like to do, periodically, I'll show a slide to sort of help focus our thinking, and so you don't have to spend the whole 45 minutes or whatever looking at my mug. But also what I'd like to do is to talk with you very much like I would in a conversational tone if we were sitting together, just you and me, in a room having a conversation about the challenges that we face right now. One of the things that occurs to me is that we are challenged right now by a number of factors that make this a particularly difficult time. And one of the things that I wanted to do in the time that we spend together today is actually to talk through some of those issues and to talk about what is it that's challenging for us? What is it about this experience that makes it so particularly challenging for us? One of the things that is absolutely certain is that these are challenging times in some ways because we are filled right now with a great deal of environmental anxiety. The future is uncertain. There is significant compromised social connection. And then I think there is, for most of us, uncertainty about the credibility of sources. Who do we believe? Who do we not believe? We hear differing and various interpretations. Some of that is driven by political leaning. Some of that is delivered by just different factors that might influence how a person sees the crisis and the times in which we are living. And so because of those things, it makes grief particularly difficult for us. My colleague used to be at University of Memphis, now at the Portland Institute for Grief and Loss, Dr. Bob Niemeyer, said even grief that didn't used to be complicated now is. And I think that's a very, very fair assessment of where we are, is that in part because one thing we know is that anxiety long before the COVID crisis was on the rise across North America. We had seen upticks over the last several years. The American Psychiatric Association both polls the general population, polls its members, and depending on which of those numbers you look at, it appears that anxiety issues were already increasing pretty dramatically over the last 5 to 10 years. I see it as a college professor with the students that come to our campus today compared to the students that came even 5 or 7, 8 years ago. I hear it from my colleagues in mental health that we see more and more anxiety, and often accompanying that, significant levels of depression. There is this level of free floating. I've come to call it environmental anxiety. It's just an anxiety that's sort of floating around the culture right now. And people are very frightened about a lot of different things. We're frightened not only, of course, about COVID, but we're frightened about all the secondary issues that don't feel very secondary related to that, how this affects me financially, what's this doing to my retirement accounts, my job security. Certainly there are people who are anxious about their own health or about that of loved ones. When we read that particular ethnic groups or age groups are at higher risk of contracting the disease or having particularly devastating consequences, be it death or very serious illness, those are very frightening, and that tends to raise the general level of anxiety that is already present in our society. And then, of course, I mentioned this a moment ago, there's this compromised social connection that's due to the isolation. I was talking to a colleague and friend of mine yesterday who, interestingly enough, lives in Southern California. And he was telling me that he ventured out to the grocery store and the pharmacy for the first time on Sunday evening. He's in his mid-80s. He and his wife have been largely stayed in their home. And he said, I was just going stark raving crazy, and I took precautions, but I said, I'm going out. And he said, I just felt so much better when I came back, having been out. He said, I stayed away from people, but he said, just to be out, away from the house, not in my neighborhood, but doing something else felt so refreshing. But I hear that more and more as we become socially isolated, or as we have become socially isolated. What it does is it means that we just don't share the face-to-face, person-to-person connection. And Zoom is great, but Zoom is not the same. Facebook Live is great, but it is not the same as being present in the room. And those who have hearing or visual impairment, of course, are particularly isolated by being dependent upon electronic communications. And then, of course, there's the uncertainty really about the credibility of sources. Who do you believe? Who do you not believe? Which narrative do you listen to? And of course, that's not just about COVID-19. That's about all things political and social, economic, and those kinds of things, and different interpretations of the same set of facts, and faith communities that appear on one side to throw caution to the wind, and others who feel that it is their religious duty to not have religious services and those kinds of things. And what I find is a part of that creates a great deal of rancor in relationships. And so all of those things have really compromised the work that we have to do in supporting people who are not just bereaved, but people who are perhaps largely housebound or that sort of thing in this. There's a lot of talk these days about this being an unprecedented experience. I teach the history of medicine. I've said this many times over the last 5 months. And so because I am an historian as well as a counselor, I tend to look at life experiences and social events much more from a perspective of a couple of millennia instead of over the last 6 months. And I promise you, it is not unprecedented. It's not even unprecedented in contemporary life. It is unprecedented for most of us in that it has not been a part of our life. We haven't lived long enough, of course, to have lived through, I think almost anybody watching this video would have lived through the influenza pandemic of 1918, when somewhere on the order, depending on which numbers you read, but probably close to 675,000 Americans died over a space of a couple of weeks in the winter and then another wave in the fall. So a number that, of course, greatly eclipsed the number that we have today, in spite of the fact that we are a population, I believe, almost double in size now. So what I'm suggesting is this is not an unprecedented time. It's unprecedented for us, but that doesn't make it unprecedented. And one of the strategies that I'm going to offer for ourselves and our own self-care, and also for those we support, is taking stock of history, because it's one of the most important gifts that we have. And as we lose our sense of history, as we lose our sense of context, things become more and more frightening. And therefore, anxiety tends to grow when we do not remember either the recent or the distant past. So what is it that we can actually do? How can we support ourselves and those for whom we care when times seem so frightening? I have actually 5 strategies that I'd like to offer. And in many ways, what I'm going to couch this as is the same thing that a flight attendant says when you get on an airplane. When they're making their safety announcements and they say, put on your own mask first before you put on the mask of those around you. Well, it's the same kind of thing. We have to first take care of ourselves and practice these strategies for ourselves. And then out of that context of practicing them for ourselves, we are then able, I think, to provide help and support to those around us. The first of those, and it seems maybe overly simple, but it is to keep doing that which we have done. Those of you who have attended workshops and things that I've done over the years know that I'm particularly fond of talking about grief in terms of a set of tasks that we have to do. I borrowed that metaphor actually from my colleague and friend, Dr. Bill Worden. I changed the names, changed what the tasks are, but they are basic adaptations, because as you've heard me say before, grief is really about adapting life before the loss to grief to life after the loss. It's about making that adaptive transition. And if you think about it, what we're walking through right now is a multiplied number of different griefs, different losses. Perhaps we've lost our connection to our closest and most intimate friends. We've lost our connection to a faith community, at least physically present. We've lost in some ways our freedom to move about, go out to dinner when we want to, and those kinds of things. For many people in our society, we've lost our sense of security or safety, perhaps because we've lost our job, we've lost our well-being, our financial well-being, and there's a great deal of fright about all of those things. And so the very things that we do to take care of ourselves in grief are the same things we do as we take care of ourselves now. And those include remembering, and that's recasting the characteristics that we enjoyed. Who am I? Who is the person inside of me? It's one of the questions that I like to ask people. In spite of all the circumstances around you that have changed, what are the immutable character qualities that you possess that have remained constant? It's a very, very important question. And I may have to do a little coaching on what I mean by that. Well, are you a person of faithfulness today, like you were before the pandemic hit? Are you a person of humor? Are you a person of love for others? How are you exhibiting that? What are you doing? In other words, we're remembering where we've been and how our life has been impacted. we find reaffirmation in this. It's another of those tasks, another of those adaptations that we make in loss. How do I figure out what the anchors, the spiritual, the philosophical moorings are for me in the midst of this experience? What do I know to be constant and solid? I recommend people write down what they discover. For me, my relationship with the divine, with God, is one of those constants. I don't always see God. I don't understand God. I don't always understand how God is at work in the world, but I am confident in God's presence. And if that is your faith perspective, that may be a reaffirmation. Often on the way to reaffirmation, however, we have to run up against the brick wall of the shattered assumptions that we frequently have. I thought that my life at this point would be like X, and it has actually turned out to be like Y instead. Coming to terms with the reality of this, it does not help to pretend that the pandemic, that the social unrest across our land, that those things don't exist. They do exist. They exist in very profound ways that touch our lives in everyday, very specific ways. Naming those experiences can be very, very profound. Far from depressing us when we begin to catalog the various losses we've experienced, realization helps us to come full face with just how great those losses are. We name them, we categorize them, we perhaps write about or talk about what those losses are. And then to let go of the relationships that we cannot hold on to in the way we used to hold on to them. In the grief process, we do that typically, or in the bereavement process after a death, we tend to do that through ritual. We say goodbye to the physical remains of the dead at the cemetery, at the crematory, or wherever. We say goodbye and we turn and move into a life without that person physically present with us. In some ways, we have to do the same kinds of things in dealing with this loss as well, is say goodbye to the world that we knew, at least for now. It doesn't mean that we will all be wearing masks for the rest of our lives. Maybe we will, maybe we won't. I sort of doubt that that will be the case, but it's certainly, for the moment, we say goodbye to life as we knew it. And we can spend a lot of time and a lot of energy pining over what we've lost and what was, and it doesn't help move us forward in any very real significant way. So all of those things help us to integrate this loss or this set of losses into the life that we've known. And that's what I mean by this first strategy of keep doing what we've always done. And I think when we provide care to our friends, to our family members, and to people who we care about, what we're really doing is we are helping to remind them of these very important strategies. The second strategy that I'd like to offer to you is to control what you can and let go of what is uncontrollable. It's one of the basic principles we have for dealing with anxiety of all kinds. And we find it to be true in anxiety, just generally speaking. In the handout that you have accessible to you in connection with this video, you'll notice that I have listed from the Mayo Clinic just a handful of ideas for how to manage anxiety in our lives. And those include, if you don't happen to be looking at the handout right now, to keep physically active. Now, obviously, that's a challenge right now, but it is something I can control. No matter how infirm I am, no matter how shut up in my house I am, there is always something I can do. I can move my hands, I can move my feet, perhaps I can sit in my chair and just move my legs up and down to the level that I am able physically to do, but there are things that I can do to stay physically active. Certainly, if you are able to, and again, depending on when you watch this and what restrictions happen to be in place at that moment, you may be able to go for a walk in a park. You may be able to go for a walk with members of your own household, as long as it's people in your own household, or you may even be able to go for a walk in in a public outdoor space with people who are not part of your household, as long as you maybe stay masked and stay a few feet from each other or something like that. But there are lots of ways we can stay physically active. One of the things we know about managing anxiety is that it is best to avoid alcohol and recreational drugs, at the very least to greatly reduce them. That is not coming from the Baptist in Texas. That is coming from the Mayo Clinic. It's their second principle. The third one is to quit smoking and cut back or quit drinking caffeinated beverages. And now that's one that cuts me to the quick. I love coffee. I have begun drinking 1 cup of caffeinated coffee in the morning. I typically will drink 1 cup of decaf a little bit later in the morning, and then I try to lay off caffeine for the rest of the day. It seems to help my sleep. It certainly helps my not feeling jittery in the afternoon and some of those kinds of things, at least after I got past the first detox of that. The fourth principle that Mayo Clinic offers is to use stress management and relaxation techniques, visualization, meditation, yoga, all of those kinds of things are relaxation techniques we can use. In fact, if you go to the O'Connor website, you'll find that there is a way to be part of an online yoga group, I believe it is. And you can, at the end of the program, you'll see both Becky LaMaca and my email addresses if you have things you want to ask about, and Becky can certainly advise you about what those options are. Make sleep a priority is the fifth idea that the Mayo Clinic offers for controlling what we can, and that's to do what we can to make sure we're getting enough sleep. For me, there are a number of things I do to try to help with that. One is I tend to eat a complex carbohydrate fairly late in the evening. I save up some calories so I can have a bowl of cereal in the evening before, an hour or so before I go to bed. Part of that is because I'm on a dementia medication and I really need to eat something when I take that, and I do that an hour or so before I go to bed. Another reason is because it helps me sleep better. And so I do those things and have been doing them now for a couple of years, and it really does seem to help. Another thing that I have found really helpful is to lay off of all screen time. That means no computer, no TV, and no cell phone in the last hour or so of the day. No playing games, no Facebook, none of those kinds of things. What we know is the blue light that is emitted by screens tends to stir up our hormonal system, makes it very, very difficult to go to sleep. And so staying away from those things at night, reading, preferably a paper book. If you use a Kindle or an electronic reader, make sure that you get rid of the blue light. Use the blue shade filter so that you don't get blue light emitted. Makes it a little hard to read. It looks like brown sepia tones, but it's much better for getting a good night's sleep. And spend that last at least 30, 40 minutes. Certainly don't watch the news. Do things that will help you relax. Take a nice bath, light a candle, do some things like that. And then last is to eat healthy. And I realize that's a challenge as well. It costs more at the outset to eat healthy, fresh fruits and vegetables. It is sad to report in many places do cost more than a lot of processed food for the amount of calories you get, but it is more satisfying long term. Of course, the flip side is most of us aren't spending as much money eating out right now as we did a few months ago, so it may be easier to order in groceries that are healthier and that sort of thing, and we can sort of pick and choose because we're often doing that on a website or something like that. So those are some strategies that Mayo offers. My point is simply this: control what you can. I think we spend so much time thinking about what we can't do and where we can't go and those kinds of things, we forget that there are a whole lot of things we can control. A third strategy is to connect creatively with others. The late Stephen Covey, in his wonderful book, and mine's quite old now, called The 7 Habits of Highly Effective People, listed, as the title says, 7 habits. The fifth of those habits was this: seek first to understand and then to be understood. If you've listened much to political discourse, to social discourse, If you watch Facebook or spend much time on social media, you probably have heard people talking over one another. There is this constant barrage of one side or another side or still a different side talking but not really listening. Covey's habit is that we spend time trying desperately to understand. Let me share with you a few questions that I tend to ask of people around me. One of those is, so what has been hardest about this for you so far? And knowing that that changes every day, but what's been hardest about this so far? And for me to not be thinking about what I want to say, but rather to listen intently for what the other is saying. What's been helpful for you so far? What's been most helpful for you in coping? With the shutdown, with isolation, with fear. I usually, if I'm asking that question as the next question up on my list, it's a reflection of what the person just told me. So if they say, I'm really just frightened right now because I keep reading the news and it sounds horrible and the spikes are awful and all those kinds of things, then I will ask, so what do you find helps you cope with fear? Sometimes they'll say, what's helped you in the past in coping with that particular thing? What was, when you've had other experiences in your life that were difficult, what did you do to cope with that? Before this experience, what was the hardest experience you ever faced? And what did you learn from that to help yourself now? And then finally, who are the people who are most in your camp right now? Who are the people who are most there for you? Who are the people you can depend on thick and thin, no matter what? They're a phone call away. You can reach out. You can set up a Zoom or a Facebook, FaceTime or something like that. And then the final thing I wanted to say is not a question, but just a principle about this as we seek first to understand others and then to be understood. And that is to be careful not to minimize or patronize another person's life and experience. It becomes very easy to do. Oh, you poor dear, that must be so hard. Sounds very patronizing. By the same token, saying, well, yeah, you think that's hard, but let me tell you about this, that's a very minimizing statement. Or, well, at least, it's true a lot of people are dying, but, people die in Africa every day. That's a minimizing statement. And while it is true, and while far more people die of other illnesses than will ever die of COVID, I think it is very, very important that we not minimize the other's experience by putting it down. Because what a minimization statement really does is it says, get over yourself already. This isn't as bad as you think, or it's not as bad as you're making it out to be. My fourth strategy. So the first one was keep doing what we've always done in terms of managing this experience of loss. The second one was control what you can and let go of the things that are uncontrollable. And that's where I offered those ideas from the Mayo Clinic. The third one was to connect creatively with others, seeking first to understand and only then to be understood, to ask rather than tell. And then the fourth one is to take your activism to helpfulness instead of just discussion. One of the reasons that I got off of the big social media platforms a couple of years ago was because I got tired of people talking and doing nothing. And I became judgmental of that. It wasn't good for relationships, and it was easier for me just to get away from it. That and the fact that it's been a wonderful time gift for me to not be on all of that. And that's not to say that my way is better, it's just to say it was my way. One of the things that I have noticed, and maybe I see it more with my collegiate aged young adults than I do with older adults, although I think all of us have the tendency to do it. Activism, being angry about something in our midst, creates in us, it stirs up in us this emotional energy that we need to do something. If we don't post about it on social media and write a rant or get on a blog or blow off on Facebook, then that energy can be reserved to actually take action. If, on the other hand, our righteous indignation, as some used to call it, is used up in writing this scathing attack on someone or some group on social media, then it dissipates the energy so that it is no longer available to us. And therefore, it seems that by posting, by retweeting, by offering an idea or an insight on social media, I feel like I've done something. And in fact, all I've really done is contribute to the noise. Instead of that, how about if we restrain ourselves from writing it all out and instead say, what could I do positive? How could I be involved? Let me offer you some ideas. I took 10 minutes early this morning. The Google search that I did was volunteer opportunities online. And I just thought, I wonder what there is out there. Let me tell you a few of them. I found 15 sites for people to volunteer to tutor students, mostly in underserved communities, in basic subjects like reading and math, social studies, and grammar. Now, most of us have the ability to do that. It doesn't take a college degree. It certainly doesn't take an advanced degree, and it doesn't take a teaching degree. Most of us have the ability to do that if we want. In addition to that 15 different tutoring sites that I found, and of course there are all kinds out there to make a few dollars. You can make $5, $10, $12 per session, $20 in some cases. But there were a number of others of those kinds of things. For example, the Points of Light Foundation, I think it's pointsoflight.org, is a clearinghouse for volunteer opportunities. And if you search for online opportunities, you find those. Another thing you can do is go to dosomething.org, which is another volunteer clearinghouse. Again, if you search online opportunities, you will find all kinds of things. The first 10 that came up, let me just tell you 3 of them. One is to edit books or transcribe books, Project Gutenberg. Project Gutenberg actually produces electronic versions of books that have been long since out of print, and they're available online for free. And anyone can volunteer to do that. Or if you don't want to be the transcriber, you can actually agree to be a proofreader. And anyone who has an eyesight and ability and an hour or 2 to offer can do things like that. And you're contributing to knowledge in the world. The Smithsonian Institution, I learned, is looking for volunteers online. At smithsonian.org, you can volunteer to actually become a content editor, to actually go, for example, one of their opportunities was to read Wikipedia articles on topics that Smithsonian has particular information about, and to correct or edit those Wikipedia articles. Of course, if you're interested in a particular topic, you can be a Wikipedia editor. It's as simple as registering at wikipedia.org, no experience required. And then the United Nations is also looking for online volunteers. My point is this: we spend an awful lot of time yammering at one another about how bad things are. And what I find is that when we put our activism to work with our feet, that it makes us feel better. I don't suggest you do it for that reason, but it does make us feel better. It's a wonderful fringe benefit. And it helps us to make a solid, positive difference in the world around us. And then here's my 5th strategy. It's to make space for your spiritual life to take root and grow. It is no accident that a faith community, Temple Bethel, is a partner with us, with a funeral provider and a hospice organization in providing this ongoing series of educational programs. Normally, the three of these organizations, O'Connor's, VITAS, and Temple Bethel, cooperate by co-hosting programs a couple of times a year in Temple Bethel's facility. But the reality is, part of the reason for that is spirituality wins its way into every issue of our life. It's part of who we are. What I have found is that this has been an incredible opportunity for us to exercise, grow, work to new ways to observe our faith. So give priority to worship, meditation, prayer, scripture reading, other spiritual practices that might be helpful for you. It is an outstanding opportunity to experiment with faith communities different than your own, since everybody and his cousin, it seems like, is broadcasting over Facebook Live or YouTube on whatever the worship day of that particular community happens to be. The second way, I think, for us to allow our spirituality to take root and to grow is to get to know history. I mentioned a few minutes ago the influenza pandemic of 1918 and 19, the Great Influenza, as it is sometimes called. It's a part of history that has been largely forgotten by most Americans. Almost none of us are still alive who were alive in 1918. We'd have to be, 102 now. Many of us, even our grandparents, were not yet alive at the time of that pandemic. And so in many ways, we have completely forgotten how horrible it was. My suggestion is that we spend some time reading. I happen to think that John Barry's The Great Influenza is an outstanding way to start. It's a fairly lengthy book that you can purchase on Amazon. It's paperback, I don't know, $15 or so. You can get it on your Kindle or your iRead or whatever you use for probably less than that. And to spend some time just taking stock of where we've been and what lessons we did and did not learn in that first major pandemic of the last generation. A third part of this spirituality piece is to start where you are, but start. What I have found in my own physical life is that inactivity leads to atrophy. Muscles that are not used fairly quickly lose their tone and their ability to act. And so whatever we do spiritually, we must do. We must get moving. We must start where we are. That may be, I haven't really given much thought to my spiritual life, to the transcendent part of me in a very long time, or maybe ever. Well, now is a great time to start. And then I think that finally, to re-say what I said a few minutes ago, is consider that social media posting or retweeting is not helpful activism. Instead, it is a spiritual principle that we look out to how we can serve others. My goodness, you could spend a few minutes a day writing a note of gratitude and encouragement to some nurse, some social worker, some chaplain at any one of the hospitals that is near your home. Send that note in a cover envelope, or send 5 or 6 of those to the director of nursing or to the director of social services, and just say in your cover letter, I wrote this note just as a word of encouragement to one of your staff. I don't even know who you think might need it, but would you mind passing it on? I would recommend that you not seal the envelope that you put your note of gratitude in. If those directors of nursing or social services are like me, they might want to know what you're saying before they put it in the hand of a particular colleague. But it may be just what the doctor ordered for a staff that is overworked and sometimes underappreciated. And that is a marvelous way to exercise your spiritual well-being. Folks, we are living in a time that some have called unprecedented. For sure, it is a time of great challenge. But as we take care of one another, and as we look for opportunities to take care of each other, we can be salt, light, 1,000 points of light, and many other kinds of things in the lives of the people around us. A smile, even through a mask, will be communicated through our eyes. A kind word to the cashier or to the person who delivers your groceries. A word that just says, I appreciate what you're doing. Thank you. Can be an amazing way to exercise our own gifts. At the same time, provide care for others. Thank you for being here.